Good morning, everyone. We are the Group 4, and welcome to our report, which is all about the tertiary healthcare facilities or the regional health services. What is inside is all about the definition of terms, from which we will define the following terms related to the Philippine healthcare delivery system and the national health situation. Part 2 will be the guide questions, from which you'll learn and understand what is all about the tertiary healthcare facilities or the regional health services. So, what is the Philippine healthcare delivery system? According to Williams Tungpalan, this is the network of health facilities and personnel which carries out the task of rendering healthcare to the people. On the other hand, a tertiary healthcare facility is defined as specialized hospitals which offer highly technological and sophisticated services. People who are afflicted with life-threatening diseases requiring highly technical and specialized knowledge, facilities, and personnel are treated here. For this part, the tertiary healthcare facility we have chosen is the Western Visayas Medical Center. Part 1, the definition of terms, and the first term to define is infant illness. So an infant illness is described as the health problems that are found in infants 12 months old and under. Some cases are serious that even contribute to an early death or infant mortality if not put into halt. Services: the collective activities of all departments and all personnel of a hospital which end up in satisfactory patient care. Death: the permanent cessation of all vital bodily functions. Maternal death refers to death that occurred during pregnancy or within 6 weeks after the pregnancy ends that are related to pregnancy or its management. Example of this maternal death are the pregnant women who have their fetus died due to unhealthy and incapacitants. Such conditions like they have high blood pressure and smoking, I think, can affect the health of their fetal child or their fetal baby. So next is goals. Goals are described as the outcomes of the actions of the healthcare agency to alter the status of the delivery of health service, and it is also for the improvement of health.
Structure. This refers to the elements of the agency and the organization. Trust. Main strategies used in pushing and advancing the aims of the healthcare system in the attainment of Millennium Development Goals. Resources. Defined as all materials, personnel, facilities, funds, and anything else that can be used for providing healthcare services. Mortality refers to the stage of being mortal. In medicine, a term also used for death rate or the number of deaths in a certain group of people in a certain period of time. Morbidity, the state of having a specific illness or condition. That term is often used to describe illness, impairment, or
Hi po kayo
degradation of
lahat.
health.
So the guide questions. In this part, we will learn and understand what is all about the tertiary healthcare facilities or the regional services. First question is, what are the objectives, goals of the healthcare agency? In this part, we have chosen Western Visayas Medical Center as our healthcare agency. So the Western Visayas Medical Center envisions to develop, provide a comprehensive, compassionate, affordable, culture-friendly, effective, efficient, and integrated healthcare system for the region. It also aims to be a responsible member of community with leadership to sustaining and improving health care programs and practices consistent with the Department of Health. Likewise, it is dedicated to develop and provide highest quality healthcare training, research, and public healthcare programs for all people of the Region 6. It will provide services to paying public at its lowest price, possible consistent with long-term financial needs, and provide subsidized care to the identified community to the extent resources will permit. So, for your information, the Western Visayas Medical Health Center is located at Mandaria, Iloilo City, and this health facility is a government-owned and it is the only tertiary healthcare facility in the whole Region 6. Next is what are the existing policies, trust, or strategies in order to meet its objectives or goals. The Medical Center Chief of the Western Visayas Medical Center, Dr. Jose C. Fermin, addressed in its quality policy that to meet their goals, the WVMC is dedicated to fulfill the highest quality healthcare services to exceed the public expectations as they commit to. First, provide compassionate, culture-friendly, effective, efficient, affordable, and integrated healthcare system for all clients. 2. Comply to all pertinent laws, legal orders, regulatory requirements in consonance with with the healthcare programs and the practices of the UH. 3. Strengthen the comprehensive education, training, and research opportunities for medical and paramedical professionals, trainees, and affiliates for competency and discipline as future healthcare providers. So the example in this part is that WBMC is also one of the inter is also part of our internship programs, especially in the university schools, which is inclined to health health studies. Fourth, promote and impose courtesy for a stronger relationship among coworkers and the general public. Fifth, continually enhance our skills, improve our facilities, upgrade our equipment, and sustain the availability of safe and quality drug medicines and supplies. Next is ensure that processes, objectives, and targets are constantly improved to achieve maximum efficiency. Number 3. How is the flow of function and responsibilities of the healthcare system? The WBMC is in connection with the Office of Secretary of Health and is under the total supervision of Medical Center Chief. This tertiary hospital, with the leadership of Medical Center Chief, controls the six assets of their healthcare delivery service, namely the professional education, training and research, hospital as center for wellness program, quality management system, hospital emergency medical services, infection control committee, and integrated hospital operations management program. Moreover, the healthcare facility has also three divisions of personnel. It comprises the nursing division, the medical division, and the support division. Meanwhile, the hospital center has also been the leading following healthcare facility. Some of these facilities are Substance Abuse Treatment and Rehabilitation Center, the Pototan Mental Health Unit, the Don Jose S. Monfort Medical Center Extension, and the San Joaquin Maternal and Child Hospital. So this is how it looks like. The Western Visayas Medical Center is organized through the efforts of the Secretary of Health, and the Secretary of Health is the one who controls the Medical Center Chief, while the Medical Center Chief acts as the main principal of the whole facility. He or she controls the six assets and promotes it. While there is also subdivisions subdivisions like nursing division, medical division, or the physicians, and support division. They also control the four facilities like the Substance Abuse Treatment and Rehabilitation Center, the Pototan Mental Health Unit, the Donese Montfort Medical Center, and San Joaquin Mental and Child Hospital. Number 4. What are the most common illnesses that are usually the cause of admission in the healthcare agency? The most common illnesses that are usually the cause of admission in the healthcare agency are acute respiratory infection, animal bites, such as those who are bitten by dogs or cats, or those who are having rabies, hypertension, urinary tract infection, the UTI, the pneumonia, tuberculosis in all forms, and the acute lower respiratory tract infections, and it also includes bronchitis, skin disease, and influenza. Number 5. What are the most common causes of death? The most common causes of death in the region, according to the Western Visayas Center for Health Development, are pneumonia, hypertensive cardiovascular diseases or heart diseases, and cerebrovascular accident or the diseases of the vascular system.
Number 6. In response to the health problems affecting the region, what are the health services provided by the health agency? In response to the health problem affecting in the region are the following health services provided by the health agency: family planning service, maternal care and services, child care services, oral health care services, infectious disease prevention and control services, non-communicable disease prevention and control services, environmental health and sanitation services. Number 7. What laboratory tests are performed in the healthcare agency? State the type of laboratory according to the service capabilities. The West Visayas Medical Center has a tertiary level laboratory. The healthcare agency provides and performs laboratory tests and that includes clinical microscopy, hematology, clinic- clinical chemistry, blood bank, immunology, serology not related to blood bank, microbiology, environmental health, special tests like stone analysis, iodized salt, borax color. It is also an accredited drug testing center. It actively participates in the National Voluntary Blood Services Program, National Quality Assurance Program in Chemistry, also a recipient of research in collaboration with RITM on meningitis and encephalitis incidence and dengue surveillance studies. Number 8. What is the ratio of health personnel to care recipients? The ratio of health personnel to care recipients in the region is 29,000 health personnel to 8,057,303 care recipients. What is the ratio of health facilities to care recipients? The ratio of health facilities to care recipients in the region is 90 facilities to 8,057,303 care recipients. What is the role of community in the maintenance and promotion of health and prevention of illness? The biggest essential to successfully maintaining and promoting health with the goal of sickness prevention will be communities working together, the communities as well as the individuals that live in them are important actors in achieving this. We people can be functioning units of society while the government and health sectors act as the brains of the movement. It is also our primary responsibility as significant Filipino citizens to participate in our community and encourage change, and that we have taken a step toward being an essential part of our country's healthcare system. Furthermore, the government need our collaboration to achieve our nation's goal and contribute to our country's progress forward into a healthy community. Moreover, the community's roles help a nation attain goals inclined to health promotion by involving active participation concerning analysis, planning, and program selection. With all of this, health is therefore seen as a resource for everyday life, not the objective of living, and health is not just responsibility for our health affiliates but goes beyond the refined practices of the community in recreating our visions, a reality, all for health towards health for all.
So all of the gathered information were from the book Health Information System for Medical Laboratory Science, and of course the websites like the ro6.doh.gov, the WBMC, the CDC, and the NCBI. So that's all for today, and we are glad to you for listening. And this is presented by the Group 4, and thank you so much.